Good morning, everyone. Good morning to everybody online, and good morning, everybody in the room. I'll ask you to gently take your seats and bring your focus. Ideally, for those that are with us in the room, thanks for coming across on a wet morning. Don't have to be in the front row, but feel free to scooch up to the front. Welcome to our climate, our health workshop. We're really excited to be hosting this event with some amazing partners that you're going to hear from today. I'm Kent Burgess, and I have the privilege of being the CEO here at Your Community Health. And I will be introducing the guests that we have with you today to really work through with a practical focus around how, as health and social organisations, we might think about moving into action on climate change, and it's thinking about its impact on health in the stakeholders that we work with in the health and social sector. So I'd like to start by acknowledging the traditional owners of the land that we meet on, the Wurundjeri people, and acknowledge their elders past, present and emerging, and acknowledge that in this space they've been caring for land for many tens of thousands of years, and that if we collaborate and listen to our First Nations people, we can gain a lot in terms of how to further our journey of looking after our planet. I'd also like to acknowledge that we were privileged to work with the Wurundjeri Cultural Heritage Aboriginal Corporation and Auntie Doreen Garvey Wandon, who named this site as Woollambori Baring, which means good health journey. So it's perfect to be talking about these topics together so that we can hopefully progress good health for all the communities that we work with and that we intersect with in our various lives and organisations that together we work with. So I'll invite those people who are in the room back out the way that you came, and to the right there are all gender bathrooms, and then we have obviously the coffee at the back and tea there, and please help yourself, and if you need to step in and out, do that. I know that you've all taken time out of what is really busy professional and personal lives. So at Your Community Health, we're really excited to lead this event, not because we are experts in climate action, but because we've worked really hard to try and create and implement a climate strategy and a climate action plan for our organisation that has an impact on reducing our organisational emissions, but also helps us to work with stakeholders on mitigating the impacts of climate change that are already with us and are growing. So we see ourselves as having a real responsibility to our community and stakeholders as community health. That's what community health does, is partner with community on the issues of health and wellbeing that are important to them. And surely there is no greater single issue than this one. So not standing as experts, but standing as people hand in hand who have worked really hard at what we do to create our climate action plan and seen some success. And we're hoping to share that learning, and we're hoping to stimulate more action across the health and social sector for your organisations to push the envelope in your climate action space. So we're really proud to have the support of our board in the development of our strategic plan, which has one of its core focus areas on climate action, and to have support across the whole organisation that has really developed into an organisational culture of, we think, focus on climate action and resilience. So I'm very proud to be part of Your Community Health and present the work today, and I'm so honoured that we have had the support to partner with the organisations that you will hear from and the experts that you will hear from this morning. Today's event wouldn't be possible without the time, the knowledge and the passion of those guest speakers. And again, I thank them for their time, and each of you for taking the time out to commit to this area, which I know we're just talking about the busyness of this time of year. So to be able to pull out time from your regular tasks is appreciated for you to be here. Your commitment to building a healthier, more resilient future is what's going to make this work impactful and strengthen our efforts together. So thanks for being here. The format today is that we've got short presentations and wisdom from key guests who I'll run through, and then very much a crowd-driven Q&A panel. So for those of you online, you'll be invited to put your questions in the chat, and those of you in the room can do it the old-fashioned way and shout out. I'll run through each of our guests, and then I'll introduce our first guest. So we have Juanita Pope and Julianne Tice from VCOS. We have Michelle Isles from the Climate Action Health Alliance. Yes, good. We have Di Parker, who I'm proud to say is from your community health and who has led with great passion and commitment our climate action work. And also we have Lindsay, who is our amazing and passionate, one of our amazing and passionate community advocates on our climate action working group here at Your Community Health. And we also have a short video from Minister Ambrosio, our Minister of Climate Action, who can't be here but wanted to offer some words to us, and also Heidi Makovich from Climate Health Victoria. So Juanita and Julianne are our first speakers. Juanita Pope is the CEO of VCOS since November of 2023. Juanita is a lawyer and consultant specialising in the not-for-profit sector with over 20 years of experience in not-for-profit governance and leadership, and over a decade at Justice Connect as head of not-for-profit law. And before VCOS, held the role of General Counsel and Company Secretary at climate advocacy organisation the Sunrise Project. Juanita has also practiced corporate law at the Federal Court of Australia. She's studied at the University of Melbourne with a Bachelor of Law and a Bachelor of Arts, so is incredibly well qualified to speak on this topic of climate action and how it impacts the not-for-profit and health sectors. And with her is Julianne Tice, who's the Climate Change Policy Advisor from VCOS, the Victorian Council of Social Service. Julianne has spent the past decade working to address climate change. At VCOS, she facilitates a climate network to build capacity within Victorian community service organisations on climate justice, adaptation and mitigation. She also researches the climate equity in Victoria and shapes findings into advice for the Victorian government to support those facing systematic marginalisation through the climate transition. She believes in the power of policy and advocacy to make positive change towards a world that supports everyone's needs. So welcome, Juanita and Julianne.
Thank you, Kent. And it's fantastic to be here amongst friends and colleagues who are passionate about the intersections between climate justice and the community sector, as is very dear to our hearts as well. And we're here today to talk about climate equity and the work we're doing at VCOS and why this work is so important to us. And then Julianne will talk about some of our current projects, some of our policy work and the intersections between health, climate change, energy, and equity. But before we begin, I would like to acknowledge that we are meeting on stolen Aboriginal land and to pay respect to the elders and ancestors of the Wurundjeri people, Wurundjeri Woiwurrung people of the Kulin Nation. I would also like to recognise that respect for traditional knowledge and promoting the rights of Indigenous communities must be at the heart of responding to the climate crisis, and to also, in that context, call out the importance of Aboriginal self-determination and the upcoming treaty process, which will commence later this month. So it's a really important time for us all in the community sector to be speaking about self-determination and the important journey that we're on towards self-determination, truth-telling and justice for our First Nations communities. I'd also like to recognise any Aboriginal people who are here with us today. So VCOS, as many of you will know, represents the social and community services sector in Victoria. Many of you in the room and online are members of VCOS, so thank you for your support. Social and community services include community health, neighbourhood houses, disability supports, community legal, drug and alcohol, housing and homelessness. The list goes on and on. It's a diverse and very important sector, one of the most economically significant industries, if you want to call it that, in our state and growing. VCOS advocates for and on behalf of social and community services, and through that lens, the people who are at the heart of our work, and that is people experiencing poverty, disadvantage or other marginalisation or exclusion. So our policy areas are disability, children and families, young people, justice, housing, employment, and as well as those more traditional policy areas, we overlay that with policy portfolios that transcend the sector and in fact transcend the systems of our society, including energy, climate change, disaster resilience and wellbeing economics. So we have knowledge in each of those policy areas, which means that we are, through our members as well and their expertise, quite well placed to understand the intersections between them. And I think that's really at the heart of our climate work, is bringing together the perspectives of multiple different organisations, multiple cohorts that those organisations assist, and overlaying that with a climate equity and climate justice lens. Thank you very much. Fantastic. So we're doing this climate justice work because climate change vulnerability mirrors poverty and disadvantage. So people living in poverty, people who are marginalised in a lot of different ways in our society are likely to experience the impacts of climate change earlier and worse because they already experience inequities that expose them to the impacts of climate change before and to a greater extent than others. And examples of that are living in very poor quality housing, leads to more exposure to extreme heat, damp and mould. The inability to afford the energy needed to stay safe at home, for example, through air conditioning on a hot day, leads to health impacts associated with extreme heat. People experiencing marginalisation are more likely to be living in more disaster-prone areas because those areas are generally cheaper. And indeed, many people do not have a home at all and therefore are more vulnerable to the extreme temperatures, to movement and all of the ramifications that come from housing instability and insecurity. These are not things that are happening in the future. These are things that are happening right now. And we know that climate change is compounding existing inequities in our society. So the other reason that VCOS sees climate as really central to the work that we do as a peak body for the sector is that climate change is impacting community organisations as well. Staff are often subjected to the same weather conditions as service users. And we've all seen in the news, etc., those incredible images of frontline workers putting themselves really on the line in disaster contexts to support communities impacted. Assets, vehicles, facilities, buildings are also impacted by extreme weather. And all of this places a risk for organisations on their ability to continue to deliver services. So ultimately, of course, for you in the community health sector, that then in turn has implications for the health of clients and service users who are at the heart of what you do. But community organisations also play an important role in addressing climate change. The sector sees and understands the impact of climate change on its cohorts every day, and the sector activates community on climate action and adaptation. We're connected to our communities, we're trusted by communities, and that places us in a really important position to be able to educate, to be a trusted source of information, to improve community resilience and other community development activities. So we're hopeful that the role of the sector in addressing equity as climate change increases and intensifies is understood, is valued, and is very much a part of the change trajectory that we all know that we need to make. So how do we do this? We have members, like, as I say, many of you in the room who work every day with people who experience climate change directly, and we draw on your expertise and your priorities to inform our advocacy. We also engage directly with Victorians to build the evidence base for an equitable approach to climate action in Victoria. And we use all of that data and evidence to advocate to the Victorian government primarily to embed equity and to have a strong equity lens in the state's climate change response and its just transition. And finally, we raise awareness of equities within climate change to outside organisations, particularly those that are focused on environmental or climate change issues. We bring that equity lens to those allies in other parts of the social change movement. I'll pass on to Julianne, who's going to talk about some of the research that we've done and some kind of themes that have emerged.
Thanks, Juanita. Yes, so I'll talk about some of the kind of major themes arising from our work, where that's come from and what we're doing to kind of build on that and address some of those themes. So one of the major themes that's arising from a lot of the research we've been doing and engagement with different organizations for our climate equity work is the mental health impacts of climate change. And we're finding, at a very basic level, mental health impacts are an impact of climate change. So we often think about the impacts of heat on our health, but there's also these mental health impacts that a lot of people are feeling. And so we're hearing a lot about both the immediate impacts that people are seeing in terms of maybe the impact of extreme heat, making people want to socially isolate at home, or not want to, but needing to because they need to avoid going outside, or direct experience with disasters. Also the future impacts that people are feeling in terms of climate anxiety, not knowing what the future holds, lack of confidence that life is going to continue on as it is because we're seeing so many changes so rapidly. We're also seeing a bit of a disconnect between the scale of the problem and the speed of response, and that's causing a lot of distress for a lot of people. So we're hearing all of these different aspects of the mental health impacts through a few different projects we've been doing, but also just conversations day to day. So we've done some community climate conversations at the end of last year where we went to neighborhood houses across Victoria to speak to everyday Victorians about what they thought about climate change. And a lot of them raised these mental health impacts. Also, the not understanding where to get trusted information, which the community sector is so important in providing that. Also a project that we're doing now around what's the capacity of Victorians to adapt to climate change or respond to those long-term impacts. And again, mental health impacts are coming up in all of those conversations about all different cohorts of Victorians. So what we're doing to address that, I'll just go back. Thanks, Jen. What we're doing to address that is really advocating for addressing the root problems. Of course, addressing the mental health impacts and providing more mental health support for people, but just addressing climate change as quickly as possible, because the more we can reduce our contribution to that and reduce the impacts that we see now and into the future, the more we can give certainty to people. And we're also advocating for more support, investment in support for adaptation for Victorians so that they can cope with those impacts in whatever way that means for them. Next, thank you. Another thing that we have been seeing through our research is the impacts of heat and the different ways that different people are impacted by heat, depending on factors like location, age, disability, lots of different factors. And so we did a report called Feeling the Heat in 2021, which detailed a lot of those different variations in how people experience heat. And along with that, we did a map comparison. So on the left, we have heat in Greater Melbourne, and on the right, we have poverty. And so as you can see, quite a simple comparison. If you're a person who's living in a more in an area with higher rates of poverty and disadvantage in Greater Melbourne, you're also more likely to live in an area that experiences more heat. And so that's simply a function of where you live. And a lot of that has to do with the amount of green space and trees in different areas of Melbourne. So what we're doing to address this is to advocate for building homes and communities that are fit for the future. So not just thinking about what's easiest to build now, what's cheapest in terms of homes and location of communities, but actually advocating for putting homes where we have the existing infrastructure now, so we don't have to build further and further out and require more in the way of cars if we're not building the supporting infrastructure. And meanwhile, if we're building out and out further, we're also building into our agricultural land, which feeds our cities and our entire state. We're also advocating for better building standards so that people are protected from the impacts of heat, not just now, but in 2050 and beyond when things are going to get hotter. So we need to not just think about what are we building for now, but what are we building for in the coming decades. Thank you. And then one of the things I think is going to be of interest to many of you working in community health is a project that one of my colleagues is working on called the Energy Health Nexus Project. And so this is a project that seeks to connect the energy sector and the health sector, which are traditionally quite siloed. And the purpose of that is to identify people who might be living in energy poverty through the health system. And energy poverty means someone who's not able to access sufficient energy, for example, on a very hot day, maybe can't afford to use their air conditioning, which would help them cool down and not experience the stressors of heat, or maybe they don't have air conditioning at all. So being able to identify those people through the health system and then refer them onto energy assistance programs is one way of combating those issues. One of the things that this project also tries to do, or is attempting to do, is to shift the narrative around energy poverty to say that this is actually a social determinant of health, and the quality of housing that people live in is also a social determinant of health. And so we're trialing a project at the moment which identifies people living potentially in energy poverty through the health system, and we're trialing a referral pathway for health practitioners. And if that's a successful program, we'll actually be able to build that digital health referral infrastructure so that GPs and other people working in health can then refer people on to existing energy assistance programs to hopefully help with those impacts of heat and also cold. And just the last one I'll briefly touch on is one of the things we found through our work is that there are lots of opportunities for networks and learning needed across the community services sector. So we've found that there's a lot of great work going on within the community sector on climate change, but not, I guess, the infrastructure in place for different organizations to be able to learn from each other. So what we've done is we've set up a climate network for community organizations. And so that brings community organizations across the state in all different subsectors together to learn from each other on different topics within climate change, share knowledge, share what they're doing. Your Community Health has shared, with me at least, what they're doing in climate action. And I hope that we can share that great information through the Climate Network next year. And we do have a meeting coming up, last meeting for the year, to discuss how community organizations can support communities and staff from the impacts of heat during the upcoming summer. So if that's something you might be interested in, have a chat with me. I'll pop my email up at the very end, and yeah, would be great to have you involved. And I think we'll end it there. Thank you.
Take your seats, and then I'll so you don't have to sit up the front during other people, and then we'll bring you up in a second. Thank you so much to Juanita and Julianne. I think it's so clearly a priority for VCOS as the peak organisation of our community organisations. You can see that the level of advocacy and commitment that they're bringing to this space, and are helping really sharpen our focus on those who are most vulnerable and impacted through climate change, and doing powerful work both in terms of advocating for change and also supporting community organisations like ours to make that change. So thank you both. I'm excited that we have Michelle Isles with us from the Climate and Health Alliance. Michelle lives with her young family on the Bunurong coast, with family on the Wotjobaluk and Noongar country, trained as a journalist in environmental law, social justice and health policy. Michelle has worked at the nexus of climate action, health and wellbeing for over 20 years. Michelle has served on the board as board director for the Sustainable Living Foundation and co-chair of Reconciliation Victoria, and is a current director of Nightingale Housing, the Energy Innovation Cooperative and the Global Climate and Health Alliance. Michelle was a sustainability leader at City of Melbourne, a general manager community and strategy at Bass Coast Health during the peak of COVID, and has coached health organisations, advised boards on climate risk, and led innovation and equity within health and other essential services organisation. So an incredible range of experiences to bring to this discussion. Welcome, Michelle.
Thank you so much, Kent, and what a delight to be here. I was really rapt to be invited to come along. I've got a lot of slides, and brevity is not my strength, but I really want to hear from all of you and have a yarn with you. That's what I'm really looking forward to. So the Climate and Health Alliance works very closely with Aboriginal and Torres Strait Islander organisations. We serve Australia, New Zealand and the Pacific Islands. And so we recognise the sovereignty of Aboriginal and Torres Strait Islander peoples. We recognise that that was never ceded. We recognise the strength of communities, but also the struggle and the really important role of truth-telling, both here in Victoria, which we can look to and point to through the URIC Justice Commission, but also through our advocacy for health. Health is an equity issue and a justice issue. And so we stand alongside Aboriginal and Torres Strait Islander communities, whether it be in Queensland around truth-telling or across the country. For me, I mentioned, some of my family connections, but I also just want to talk to my community. So this is taken in Wonthaggi in South Gippsland on Bunurong or Bunurong country. And one of my colleagues, I worked with Annie Professor Justina Fergie to appoint our first Aboriginal Health Liaison Officer for the region. As Paul Patton described, it was there was a gap in services. Let's say, mob were travelling an hour and a half to either here in Naarm or over to other parts of Gippsland. There is big community in Gippsland, but in this particular area, people weren't using services. And so in acknowledging that truth-telling, and it's part of my family story as well, hospitals and health systems played a role in justice and inequity. And so creating those culturally safe places, self-determined spaces, has been a passion of mine and something that I think is critical in health. And this is our first People's Committee that we set up in Bass Coast Health through discussions with mob around what was needed. And it actually had a really, it was a catalyst for a greater movement of community coming together, seeing that leadership in health and throughout the region, but also throughout other areas of community. So the next slide is our whole community gathering across the bridge to Malau, which is Phillip Island. And that health leadership and governance has actually catalysed a greater movement of, as I said, allyship support, but also health, justice and equity, and having those honest conversations. The next slide. So at CAHA, the Climate and Health Alliance, we say together we are powerful. And unlike the role of VCOS, we work with our members across Australia, though, New Zealand and in the Pacific Islands. And we're actually part of a global organisation, the Global Climate and Health Alliance, and also with Healthcare Without Harm. Really proud that Your Community Health is a member. Our members come from very diverse backgrounds. We've got 120 from about 70 health professions, but also small Aboriginal organisations in remote areas. So quite a diverse group, but we come together with purpose to focus on climate action. And I'll just go to our mission in the next slide, that we want to build a powerful sector movement for climate action and sustainable healthcare. And I would say in the last few years, there's been this incredible growth in that movement. So 3 years ago, we had 45 members of CAHA. We now have close to 120. So although climate change has been with us and we've known about it for a while, there is this momentum because we're seeing it, we're feeling it. And our team at VCOS talked to some of those impacts. And we want to see that health plays a leading role in restoring a safe climate and an ecologically sustainable and just healthy world. We have a role as trusted leaders. We have a role in serving our community, and we also have impact. And that's, we'll get to the terrific work of the Your Community Climate Action Plan soon. I'll keep going through. So climate change is a health problem. I've in recent years been skipping over this slide, and we don't need to talk about the definition of global warming and climate change. We all get it, right? But actually there's some dissonance. I think we need to actually bring our community along. And the reason we need to do it is because, frankly, the fossil fuel industry still has social license in many parts of Australia, but is causing harm. So we actually need to communicate that, yes, greenhouse gas emissions, we've always had fires and things that actually are important. They trap a bit of heat, otherwise this place would be inhabitable. But what we're doing is producing more fossil fuels into our atmosphere than we can cope with. And that is actually then trapping heat and warming our planet and creating great instability. And just like our bodies, when we overheat and have fever, and particularly are vulnerable, those moments when your baby's got a fever, that is what's happening to our planet. And now we're seeing it every week. We're seeing the climate shocks and stresses. But I think it's important to join the dots. In my community, when people say, oh, the life-saving club's about to collapse, they're talking about why isn't council, put the barrier up? But we're actually not talking about why. Why is the sea level rising? Why are we having these storm events? We need to change our behaviour and change what we support. So we started 14 years ago, and the Lancet Journal is the very famous health journal that comes out of the UK, and we wanted to respond to this threat on the 21st century. So that was sort of our catalyst. But of course, we're now seeing a whole range of vulnerability factors across our systems. Health and climate are absolutely interlinked, and climate change is a multiplier threat. So it's exacerbating existing health conditions in our communities, and also has the potential, or already is, undermining some of our great progress that we've made in health in this country. And so you can see some of the particular climate sensitive health risks that we've mentioned already, such as heat, mental health, food and water security, infectious diseases, air pollution, sea level. There's quite a bit of heavy stuff, I should say, in these slides, but we'll get to some action. These are some of the things we need to think about, and just in a bit more from some different angles. It's interesting working I've been in the Climate and Health Alliance now, CEO for 7 months, and I'm working very much with health colleagues that are deep in health and infectious disease, and then also in the climate space. And then we're trying to talk to politicians that like economic arguments. And so it's actually about the way we frame it, but it's all connected. And I think that's the important thing. And so the next slide just gives you another angle about the environmental degradation, what that means for health. at a global scale, forced migration, oil conflict, mental health impacts. If our systems are under pressure because of our addiction to fossil fuels and overconsumption, then we're leading to more impacts on our health and well-being and ultimately our survival. So luckily our friends at the Lancet came up with a more optimistic catchphrase as well, that tackling climate change could actually be the greatest global health opportunity of the 21st century. And so the Climate and Health Alliance has advocated for many years for a national approach. Thank you. I'm going to have to skip through these a bit more. So we've got some commitment. I also just wanted to put, there's some very real conversations around cost of living. And so climate change does increase health costs. There's some examples there. And our most vulnerable populations are at greater risk. And I think you'll be very, aware of that. And we've heard a bit about that from BCOS. So there's a whole raft of evidence. We in Australia have a Lancet countdown, and so each year we actually track the progress on climate and health. And this year, the report talked to the health hazards and impacts, the adaptation, the impact of food, so eating meat, the use of on land, as well as, of course, fossil fuels. It tracks how we're going, and it's something CAHA each year communicates in a way that's accessible, so we can share those reports. We've talked about extreme heat. There's an extraordinary amount of evidence now available. When CAHA first started, there was a handful of research organisations starting to look at climate and health. We now have really great credentials across Australia. We've got many research units dedicated to this work, and some funding starting to flow in. So we're seeing now dedicated studies to mental health impacts on young people, which, is something we really need to heed. And also cardiac strain and other, again, exacerbating existing conditions and indeed causing some. Asthma is something that our community, particularly children, are particularly vulnerable to. And there's this terrible cycle that we see. So air pollution causes asthma, but also air pollution causes climate change. And then we're seeing thunderstorm events and, more impact. But we're also seeing some opportunities to reduce the role that we in treating asthma. So there's this terrific roadmap that's been released by Asthma Australia. Gas is harmful for our communities, both at a production scale, but also in our homes. And it's something that I care about a lot, because the transition is something we need to manage. When we're cooking on gas stovetops, we are exposed to harm. So making sure, and luckily in Victoria, we do have some measures in place to provide some financial support to transition. But this is me at a Ascend inquiry, and I've been at many around the gas industry, around that social licence. We actually need to break that down and say, what are the health impacts? What we need to do is put health first. I think I've talked a little bit about air pollution, but we've got some good resources there. And we're also focused on plastics. Again, not a good news story. We tend to think about the bottles bobbing in the ocean and the plastic we may use in healthcare, but we're actually focused with our colleagues globally on the production of plastic, which of course draws on fossil fuels. And as we transition away from coal, we're actually moving into petrochemicals. So again, we see plastic. We don't want plastic to be in our health services, in our streams. Luckily, I'll get to the good news story. There is a global plastics treaty being negotiated at the end of this month, at the next stage, and we successfully secured plastics in healthcare to be on the national stewardship list. So our environment minister is looking at this seriously. We track what's happening over what we now call an angry summer across Australia. So this is some of the evidence that we gather from all of the research community from the Bureau of Meteorology to then communicate, and we get health leaders to talk to some of these impacts, including hospitals. I managed a hospital during COVID, but also with the shocks and stresses of storms and floods and the like. So making this real and getting health leaders to talk to it. I mentioned research quite a bit. Just yesterday, a new resource was released from the Australian government talking to where there is currently research and where there are gaps. So it's something as some good evidence to look into. I might just skip through the strategy slides given time. Needless to say, we've done a lot of work on strategy and advocated a national health and climate strategy and tracking where it's at. Health assessments for approval of big projects and making sure we're actually resourcing this effort is really critical. There's lots of co-benefits to climate action. I might just skip through these as well. I really went to town on these slides. I'm sorry about that. But I can share these later. And action, look, one of the major things that we do is try and provide the information to health leaders across our communities. So whether you're working in public health, in community health, giving you the information that you might need to talk with your patients, with your community, but also to speak in the media. And so we do training to get that information in your hands to be able to communicate the links between the issues that I've raised. And we did a lot of work on really understanding what communities need. So I might just flick through the next pages. Thank you, Jen. You're doing an amazing job. We'll just flick through all of these. Basically, what I think was missing from this is more community health leaders telling us. So that's something I'd like to know more about, the experiences of community and from primary health around what resonates, what information you need, and I think that's something we can focus on. And there's some really key messages. So activating, is it just some, a bit of a slideshow of some familiar faces might be there, but throughout, but travelling around the country, getting community leaders to try and influence. If we can build trust in our community, then our leaders will actually have the confidence and courage to make the decisions we need to safeguard our health. And that's our sort of theory of change. And we do that throughout a local level and then at a political level. So there's also some fun pictures there. That's some of the work we've done of applying that political pressure. But of course, we've got a role to play. The health sector in delivering health creates impact, whether we like it or not. Our first focus is on our community and patients, but we also want to apply. We know that value of care is not what it could be, particularly in the tertiary sector. So we are working with our health community and the Global Green and Healthy Hospitals program, of which, again, your community is signed up to. We have many members across Australia and New Zealand working on some of the solutions around environmental impact, but also looking at how are we delivering care. Do we need to prescribe this? Do we need those extra tests? Looking at what's the best outcome for the patient in the context of community and environment, and then looking at how we can, reduce resources while delivering a better outcome. And building resilience is a big part of the support that we're gathering for that work. So, as again our team from VCOS are talking about, how do we respond to the challenge while building resilience? What are some of the impacts, the shocks and stresses we're going to see? And how can we work as a network across our region to understand those, share ideas and make progress? There was some great progress from public health, campaigns that we can look to, because these challenges can be overwhelming and I don't wish to paralyse, I wish to mobilise. And so just a final slide, we've got 100 members. They're a resource for you to draw on. 12,000, actually, it's up to 20,000 supporters. Sorry, I didn't update that. But also we've got over 2,000 hospitals or health systems, which is even more hospitals and health services that are working on solutions. So they are a resource to be able to tap into, and me and my team would be very happy to help.
Thank you, Michelle, and a brilliant job at crystallising the enormity of the issues and the link between climate change and health. Such an enormous topic, and I can attest on behalf of one health service how powerful it is to have the support of CAHA in terms of policy and guidance as we have embarked on our climate action journey. And Michelle finished up with that very positive call to action that all of us as organisations have to be leaders and to be proactive in this space and to step in. And it can feel overwhelming with the enormity of the problem, and the resources of CAHA are so helpful in helping us to break that down into where we start as organisations. And that's what we want to share now as an example of one organisation and our journey so far in this space. So I'm really excited that we have Di Parker, who is our Chief Financial Officer here at Your Community Health and oversees all of our corporate services. Di is the executive lead on our climate action plan, and her dedication and strategic oversight, meticulous attention to detail, and her passion has been instrumental in driving Your Community Health's success and our progress to date in this area. So I'm really pleased to welcome Di.
Thanks, Kent, and good morning, everyone. And thanks for taking time out of your day to join us here or online to learn about our climate action plan. I'd also like to acknowledge the traditional custodians, the land on which we're meeting today, the Wurundjeri people of the Kulin Nation, acknowledge that they've never ceded sovereignty, and reiterate Your Community Health's strong support for the treaty. The support and commitment from the board has been really important to the success of our climate action plan. Our board recognises that climate change is the largest global threat to health and has been included as a strategic priority within our strategic plan since 2017. The board and leadership team are committed to reducing our emissions and supporting our clients and community with the health impacts already being experienced through climate change. This approach ensures that the work isn't just a passion project of a few people within the organisation, and it doesn't get lost in the competing priorities of busy and resource-limited organisations like ours. Our climate action work really began in 2019 with the establishment of our first environmental sustainability working group. This was an expression of interest process for passionate staff and consumers to join this working group. And it actually really wasn't that difficult to get a really good cross-section of staff across the organisation. Climate change is something that people are increasingly aware of and wanting to make positive changes towards. And it was really pleasing to see how many staff within our organisation were already really passionate about this cause. Initially, the working group focused on energy and waste reduction initiatives, identifying 2 to 3 sort of quick win initiatives that we could implement and then build momentum from there. So the first 3 initiatives that we focused on was a campaign around turning off our computers and monitors at the end of each day. And this is something we still do now, and we conduct sort of spontaneous audits over and issue, like you'll come in the morning and you'll have a little star on your computer if you've done the right thing, or some little prompt about like you've done your computer but you haven't done your monitors. The second one was we did a Think Before You Print campaign with posters and education pieces in all of our publishing rooms. And the third one was we did a Bring Your Own Coffee Mug campaign. Now, these aren't the big ticket items that are going to get you 60% reductions in your emissions or anything like that. But what they did do is they built a culture of environmental responsibility within the organisation. They provided an opportunity for staff to be involved and to take action, and it really generated, embedded the culture across the organisation and led to staff coming forward with new ideas and suggestions of other things that we could be doing. Other successes of the working group, including we did a review of some of our organisational processes and identified some areas where we could make some changes. So a couple of examples of those were we digitised created electronic versions of our client information welcome packs. So previously these were only available in printed hard copies and handed out. Clients didn't have an option to be able to receive an electronic version. And another one was we digitised our end-of-day banking processes for our client service officers, which were a really paper-heavy process prior to that. And then the working group engaged staff through climate-related events like Ride to Work and National Recycling Week, which it is actually this week. Then we got to March 2020 and COVID hit. And like many organisations, it felt like everything pivoted at that point to the COVID response, and the working group lost a little bit of momentum. But at the same time, we were also able to successfully implement some more significant infrastructure projects. So we installed solar power at this site and also at our Northcote site. Northcote was funded through a Sustainability Victoria grant. And then in 2022, we also commenced our transition away from petrol-fuelled fleet vehicles with the purchase of our first hybrid motor vehicles. 2022 was also the year we launched our new strategic plan. And Your CH's 2022-2026 strategic plan continued our emphasis on our strategic priority for climate change, including that we will be environmentally sustainable and address the impacts of climate change. This was a broader remit, covering both our own emissions, supporting clients to manage the health impacts of climate change, and advocating for bolder climate action. The working group was reformed in late 2022, once again with a broad representation across the organisation, including executive, strategy planning and advocacy, comms and marketing, facilities, IT, and a good representation of clinicians across different programs as well. We also felt it was really important to have consumer and volunteer representation on the working group as well. So we advertised broadly for people who were interested in joining, and we have 2 consumers and volunteers on our working group, and you're going to hear from Lindsay shortly. This time, rather than just having an internal plan, it was decided that we would develop a climate action plan that we would publish on our website and report against annually. There were a few reasons for making this decision. Demonstrated a commitment to transparency and accountability, committed the organisation to tracking and reporting progress, ensuring that we didn't lose momentum in implementing the plan. It builds internal motivation with staff to see a clear shared commitment. It invites collaboration with other organisations, encouraging partnerships that can amplify climate efforts. You're seeing some of those partnerships and collaborations here today. Increasingly, client and community expect organisations to demonstrate environmental responsibility. Publishing our climate action plan shows we are taking a proactive approach to addressing climate change. By publicly committing to climate action, we hoped to inspire other community and health organisations and not-for-profits to take similar steps, creating a ripple effect that supports broader climate action. And that's the purpose behind hosting this event today. The climate crisis requires collective action. It's something that we need to support each other with and work collaboratively on. So moving into how we developed our climate action plan. I'd recommend not overcomplicating it or thinking that you need to reinvent the wheel. The first thing we did was to research what climate action plans other healthcare, government organisations or not-for-profits had in place. This gave us some really good ideas of what we wanted to incorporate within our climate action plan. The working group then agreed on 3 broad priority areas for the climate action plan. which were governance, education, and advocacy, supporting clients with the health impacts of climate change through service delivery, and becoming a sustainable healthcare organisation. Within these priority areas, the working group then identified the actions that we wanted to include to be able to achieve these broad goals, the timeframes for these and the responsible roles. I won't go through each of the actions in the Climate Action Plan. If you haven't had a chance to read our Climate Our Health, which is our Climate Action Plan, it's QR codes up on the walls where you can access them. The next step was to measure our baseline emissions. It's probably the part of our plan that I get the most questions about and asked what consultants did we engage, etc. But it actually wasn't as difficult as what you think. It can be incredibly complex if you want to go down measuring like your supply chain emissions, etc. But for our first climate action plan, we decided to focus on measuring our internal emissions and also our waste and then our staff commuting. Now, it's another thing that's not as difficult as what you think is that a lot of this information your suppliers are already measuring and reporting, and it's really accessible to you. So I'm not trawling through all of our invoices, trying to find the information on them or anything like that. Your electricity, your gas providers, they will have portals and reports that you can run that readily give you this information. Similarly, our waste provider also has that. Staff commuting was a little more tricky, but we've set up an annual staff commuting emissions survey that staff complete. A lot of information publicly available around how to measure your emissions, and we use this information including like the different types of vehicles, the different types of fuels, and how many emissions per kilometres they generate, and that's how we created this survey. And we get a really good response rate from staff each year as well because staff are so engaged in supporting the climate work that we're doing. Once we have our baseline emissions and reduction targets prepared, we're able to use this to set an overarching target, 60% reductions in emissions by 2030 and net zero no later than 2040. The no later was actually really important to the working group because we wanted something that we thought that we could realistically achieve, but we also didn't want to constrain ourselves from getting there earlier. Once we had developed a draft of the Climate Action Plan, we felt it was really important to get broad consultation on the plan to ensure we were developing the plan that was robust and effective. We sought feedback through staff, clients, our Consumer Advisory Committee, members and the public through promotion on social media. We're also very fortunate to have the support of Darebin Council, who promoted it through their monthly sustainability newsletter as well. So if anyone from Darebin is in the room today, we thank you for your support. The Climate Action Plan was then ready for board approval, which occurred in July 2023. The plan was officially launched at our All Staff Day in August 2023. So all up, the plan took 8 months to develop from inception to board approval. There's already been a lot of work done prior to launching the plan in terms of embedding a culture of climate action across the organisation, but this is something the working group wanted to build upon. It's sort of critical to the success of your climate action plan, but it's not just the working group members who are involved in the climate action work, but there is a real understanding of the importance of the work across the organisation. We launched the Climate Action Plan at our All Staff Day, and at the same time did a workshop with staff around ideas of what the organisation and in particular their programs could be doing to reduce emissions. We then implemented a Climate Champion program in the organisation where nearly all programs have a climate champion in their team. Climate champions are passionate and committed to climate action. They ensure that climate action is an agenda item on all team meetings. They're the conduit of information between the working group and their teams. They drive key organisational initiatives like Ride to Work Day, Plastic Free July in their teams. They're responsible for initiating discussions within their teams about what programs can be doing to reduce emissions and feed that back to the working group. And they ensure that climate action goals are included within their program plans. To support this, we actually updated our program planning template as well to include a climate action goal. And we added climate change as a risk to our organisational risk register to recognise the significant impact climate change can have on the organisation, our operations and service delivery. There are a lot of resources available that can support you with climate change. We're a member of the Global Green and Healthy Hospitals Network, which CAHA operate for the Australian-New Zealand Pacific region. It's currently free to join, gives you access to emission calculation tools, resources, members' meetings, and most importantly, a network of healthcare organisations to collaborate with, share ideas and learnings. We're a member of the Climate and Health Alliance, member of BCOS and their Climate Health Action Network, and we joined Healthcare Climate Challenge as well as Race to Zero, which commits you to measure and publicly report your emissions annually. We're also very fortunate to be in the Darebin local government area. Darebin were the first local council to declare a climate crisis emergency, and they do a lot of work to support residents and businesses with climate change. So I definitely recommend you connect with your local council and their climate teams and see how you can work together on this. We're really proud of what we've been able to achieve in the first 18 months of our climate action plan. We've completed 57% of the actions, reduced our emissions by 23%, transitioned 85% of our motor vehicles to electric, including our first electric bus. They're out, you might see some of them out there in the car park. They've all got our climate action branding and have catchy electricity themed names. The bus is called Charge Chariot. Got solar power at all of our sites, solar hot water at 2 of the 3 sites, rainwater tanks out here that all the toilets at this site are connected to, other infrastructure upgrades like LED lighting, sensor taps, sensor lights. Last summer, we ran a heat health campaign for clients and community in collaboration with Darebin Council. We've done 31 internal and external client communications over the past year. We've engaged staff in events. We do plastic-free July bake-offs, sustainable festive season activities, Ride to Work Day, and we've done 14 advocacy submissions seeking to influence state and federal government policies for broader climate action and protection of health, including a submission to the National Health and Climate Strategy, position statements and letters to ministers requesting the end of proliferation of fossil fuels, supporting Healthy Futures' successful campaign to ban gas in new builds in Victoria, as well as many more. We were thrilled to be recognised for our efforts in climate action with 2 awards in Healthcare Without Harm's Healthcare Climate Challenge, with a silver in the leadership category and a silver in the mitigation category. Lastly, we hope that learning about our climate action plan today helps your organisations in their climate action efforts, and we're more than happy for people to reach out for any advice or assistance that we can provide.
Thank you so much, Di. I'm incredibly fortunate to have Di lead this work in the organisation and really being able to capture the interest of staff and community members and volunteers across the organisation in this work. And part of the success has been, as Di articulated, being able to show progress in the little ways and then different points of success and celebrating those as we go along. And those electric vehicles that, you know, when we started with coffee cups in 2019, and here we are with 85% of our vehicles in electric and our own charging stations, and the electric bus fleet has begun, and which is just an enormous visual representation of the progress that we have made. And hopefully you can steal our climate action ideas, and of course our plan is on our website, and of course we've stolen the ideas of others as well. And of course it's not theft, it's it's sharing and supporting each other in this beautiful sector that we all work in. And I'm really excited now to hear from Lindsay. Lindsay is not only a community member and volunteer that has supported our climate action work, but comes with an incredible amount of experience in health and climate. Lindsay is a registered nurse who specialises in cancer care and has a growing obsession with sustainability and is happiest when she is lost in nature. She's currently working as a clinical nurse consultant. She has a Master's of Advanced Nursing Practice and a graduate certificate in climate change and health, both from the University of Melbourne. She is, however, most proud of an email from her previous manager who said that she was missed for her passion for rubbish segregation. So as you can imagine, we're pretty lucky to have Lindsay working with us as our community member in our Climate Action Working Group. Welcome, Lindsay.
Thank you for inviting me. I might stand over here so I can sort of see my slides a bit better. Now, I've been invited to talk about being the community representative, but I mean, I feel like a bit of an imposter given the lineup today. So I thought about what can I talk about that's a bit different. And so I did think that unlike our other speakers today, I'm not employed in a management position and I'm not employed in a sustainability position. I am working as a healthcare professional. I work clinically on the floor. And so I thought I'd talk about my experience being a healthcare worker trying to enact sustainable change essentially from the bottom up, and really how as management, you can support your clinicians. So I guess a little bit about my journey to how I got here. I've been a registered nurse for quite a long time now, working in oncology. And I've always been incredibly frustrated with the amount of waste that we have and quite horrified, to be honest. But increasingly so, I think, concerned about seeing the impacts now of climate change on our patients. And so we've spoken a lot about the impacts and focusing particularly on heat. Even on a moderately hot day, sort of in the low 30s, we're seeing patients coming in dehydrated with low blood pressure. And so I know in one of the slides, I think, Michelle, it was one of yours, that Victoria reached 43 degrees. And so that sort of heat for our cancer patients, our elderly, those with kidney problems, it's going to be fatal. So we really need to be sort of proactive on that. And I'm also concerned about the impact on our healthcare system. So the hospital that I work in is at capacity on a daily basis. We cannot get beds for our patients. We have ambulance ramping every single day. So we're not really currently equipped to deal with the increase in admissions that we're going to see in a heat wave, bushfires, and increasing thunderstorm asthma events. And so we're really going to have to start putting strategies in place for how we're going to manage those. So I guess this interest led me to last year start the graduate certificate in climate change and health through Melbourne University, which is a great course for anyone who wants to do some further study. And then I looked for some volunteering opportunities to use both my experience and my study, and found the Your Community Health Climate Action Working Group. Next slide. So I guess why should you have a community representative on your climate action group? And I think the biggest win could be getting some experience from outside of your organisation. And so, you have no idea who's going to volunteer. It could be somebody with waste management experience, energy transition experience, healthcare, sustainability. It's a real opportunity to bring in that outside knowledge. And I hope that I've been able to bring both my experience, some resource perhaps that the working group's not aware of, and thoughts on how they can support their climate champions. You'll gain an understanding of local concerns and develop ties with other organisations. And obviously we've spoken a lot about that today, but as we increasingly need to adapt to climate change, we're going to need to be educating our community, and people in your community will have different sources that they trust the information from. And they need to be aware of places in the community that they can be safe. If their house is not equipped to protect them from the heat, where can they go? And so it's going to be a real community effort. And so what do I gain? Next slide. From my experience. Well, I feel really proud of the work that Di and the team are doing. We've seen all of the initiatives that they've implemented, and they've brought so many different
departments within their organisation together under this one goal. And it makes me really, I have a lot of hope, especially seeing everybody today who wants to enact this in their own organisations. And I think hope is something that's obviously increasingly necessary, especially after the last week. It's a chance to offer my lived experience, and it's a chance to use my studies. Slide. So what is my experience as a healthcare professional? And now this is going to be quite nursing centric and also predominantly focused on sort of clinical waste. But I think that hopefully it extrapolates across other disciplines and also other projects that people might want to implement. One thing that I've found is that climate change and sustainability are not really spoken about on the clinical floor. However, your staff do care and they are concerned. Now, recently I rolled out a project where I had to survey staff. And I was quite stunned not only by how many people responded to my survey, but they also approached me independently to tell me about things that they would like to implement. And some of those we've actually started enacting. Probably the most important is that your nurses or your clinical staff are time poor and their priority is always going to be patient care. And so if you want to introduce an initiative to your clinical floor, it needs to be just as easy or easier than the status quo or the behaviour that you're trying to remove. So just as an example, about 18 months ago in my department, we introduced recycling bins. Before that, we didn't recycle anything. However, even today, all of the milk cartons, which surely is a fairly recognisably recyclable item, go straight in the bin. And that's because the recycling bin is probably 2 metres away and it's around a corner. And those few extra steps is enough to mean that it's not utilised. So you really need to be making sure that new actions can be just incorporated incredibly easy into practice. The other thing I've noticed is that lots of clinical waste initiatives are driven by individuals. They're not driven by sustainability or waste management teams. And they're often individuals in individual departments. And so the downfall to this is that it leads to staff burnout because they're very often doing this on top of their day job. It often means that projects fail if that particular staff member leaves. And it also silos initiatives into independent departments and not across organisations. So how do I feel as management you can support your team? Talk about it. Make sustainability a really regular topic. Empower your staff, ensure that they know that this isn't something that's just the remit of your waste sustainable energy team, that everybody can be part of the solution. And so we've heard of some of the great initiatives that the team here are doing, including sustainability goals into program plans, having the climate action team. I don't know if you're currently doing or there's a plan to include information into new starter packs. And really using the comms team to ensure that all new initiatives are really widely advertised. 2, provide time for your climate champion projects. If your clinical staff have enough time to either complete their patient care or their sustainability project, then your patient care will win every single time. So if you want staff to actually undertake these projects, they need to have the time. It doesn't have to be a lot. It's not whole days. It might be just patient allocation that means they have an hour at the end of the day once a week. Just something so that they have some protected time. And ensure that initiatives are available across the whole organisation. So if one of your departments has a great idea and runs a successful pilot, roll it out across your whole hospital, because this sort of siloing of ideas really just slows things down. I think you'll be really surprised by the enthusiasm that you get within your organisations. People really want to see change. So I'm really thankful for everyone that's come today, those who want to enact change within their own organisations. And I hope that I've been able to give you, I guess, a couple of tips of how you can support your staff. Thank you. I feel like I raced through that, sorry. Thank you. Now, I know that I was going to run out of time to talk about my study, so I thought what I would actually do is just leave a slide up that's got some resources that I found to be really helpful when you're putting together sustainability projects. So I thought I'd just leave that up there. Thanks.
Thank you, Lindsay, and it's so great to hear the perspective of someone working within the health system at the healthcare client-facing level, who is really bringing leadership and passion from the ground up into organisations, and holding management and leadership hopefully to account for what we need to be doing to support the work on the ground. And as Lindsay and Di have both spoken about, it's so important to take up and embed this work systematically, so that we're not relying on the goodwill of individuals who will burn out and move on, but taking that energy and that goodwill of amazing people like Lindsay and building it into our organisational systems, processes and projects. But now I need to acknowledge that in the work that we've done at Your Community Health, we have had a couple of grants from our state government. We had a grant for our first second round of solar panels at our Wallumbori Dumba Northcote site, as Di mentioned, and we also had a grant to install the electric vehicle charging stations at our site as well, which has been incredibly helpful. And we have a short video from Minister Ambrosia, our Minister for Climate Action, who is an apology today, but did, as I said, want to just share a brief message, which we'll play now. Okay, so we have an authorising environment from our state government, which just makes our job easier. Of course, we need to well and truly push beyond that. And I'm really pleased that from Climate Action Victoria, Heidi is here with us. Okay, sorry, Heidi. So Heidi Matkovich is the Director of Climate Health Victoria within the Victorian Department of Health. and Climate Health Victoria is the new unit, as the Minister mentioned, overseeing the state's climate change and sustainability actions. And Heidi brings over 15 years' experience in public service with roles across strategy, policy development, program delivery, governance and infrastructure, water, land management, and health. She's a member of the Federal Climate Action Authority and previously worked in communications and knowledge translation for health service research in Canada. Welcome, Heidi.
Thanks very much. And I'm conscious that I'm the last speaker and I'm now staying between yourselves and both morning tea and questions, which I'm sure will have built up. So I'll try and keep it really brief, but I am delighted to be invited to talk here today. And I'd like to begin by acknowledging the traditional owners of the lands on which we meet, the Wurundjeri people of the Kulin Nation, and pay my respects to elders past and present and to any Aboriginal colleagues that are joining us today. I also acknowledge that sovereignty was never ceded. So thank you for the introduction, Ken. As the Minister and the Parliamentary Secretary highlighted, Climate Health Victoria is a new unit in the Department of Health. We were established in around February this year as part of a broader organisational restructure of the department. But if I can flick to the first slide, if that's okay. We were doing quite a bit of work in the department before that date. So this kind of diagram gives you a bit of a sense that we've traditionally had a fair bit of action going on in our health building authority and really focusing on our infrastructure and our assets, particularly the hospitals. So we've had colleagues there doing some great work in terms of both the way that new facilities are built and as well as retrofitting solar and energy efficiency improvements. And we've also had a lot of amazing colleagues in our community and public health division doing work on the health impacts of climate change. But what we weren't doing as much of was listening to particular calls from the sector, the health sector, which wanted to see more action within the health sector and how healthcare is delivered. So when Climate Health Victoria was set up, and actually I'll come to that in a minute, it was really on the back of a lot of advocacy from really important groups, which I'll show in a minute. But it's to recognise, I think, the role of those voices in the health sector and passionate clinicians and passionate people to say that this is something we needed to do. So our unit is now kind of coordinating activity that was already happening across our department, but also taking a particular focus on a few different areas. So if we can flick to the next one, we sit very much within a, particularly in Victoria, a really important authorising framework with our Climate Change Act has driven a huge amount of change in Victoria and now fortunately being mirrored in other states and federally as well. And we have had a lot of action through our climate change strategy over the years, which has been hugely important for us. We were really buoyed with the launch of the National Health and Climate Strategy late last year and are now working really closely with our colleagues in our counterpart unit in the federal government. And we also, as the Department of Health, have some really important kind of strategic directions ourselves, as well as particularly I wanted to mention the overarching health and wellbeing of Victorians, of course, is a key one, but there are some really important reform directions around delivering care closer to home and things like that, which are really important for our agenda. So if we can flick to the next one, this is just to recognise some of the partners that I mentioned before who've been really instrumental in the way that we've established our unit and continue to shape the way that we will work, and really delighted to have Michelle talk here today and acknowledge as well I was really, really pleased to hear the message from both Di and Lindsay about the two things. Important to recognise from Di that this is a really achievable task and that there's resources there. And I love the message about being able to, you know, be a hand for help. That's one of the things we want to do in our unit in particularly. And Lindsay, great message about kind of how important clinicians are and what the experience is. That's something we're really interested in building and learning from clinicians as well, just to understand, you know, patient care is always going to come first, but so many initiatives that we can drive in this space can be done with that in mind and then also deliver, you know, climate benefits. So that's something we're really passionate about. we can flick to the next one. Our work program's kind of got three main pillars: decarbonisation, adaptation and collaboration. And if we keep going to the next one, decarbonisation is, from our perspective, we're probably much more focused on, and I think reasonably so, on hospitals. They are, pardon me, one of our biggest sources of emissions that we measure well at the moment in Victoria, but we're really conscious that actually a lot of the emissions in the sector come from what we call scope 3 here. I won't get into the technical detail, but we're actually not as good at measuring that at the moment, and a lot of that's about the way that care is delivered. So we're doing a lot of work to try, and again with the Commonwealth as well, better capture and measure the data on the way that patient care is delivered. But we do still have a lot of interest and work in some of the big ticket items like moving away from gas facilities and infrastructure in the space. So I won't spend too long on that, but if I can flick to the next slide, I think what's really important for us and important for, pardon me, organisations like your community health in the sector overall is that the best patient is, pardon me, the one that never comes to hospital. So the importance of keeping patients and keeping community members well and keeping them out of hospital where care is incredibly emissions intensive, and also not, I think, what most people, where most people want to be, is that's almost, you know, the key sort of pillar and remit of our organisations here, is really kind of driving that population and preventative health is hugely important. So we're really, really interested in the broader part of our health department, how we can support that and how we can support models of care that keep people at home and keep people well. So that's, if we can flick to the next one, that's just a few kind of things that we're doing in this space. But adaptation, if we move to that, we, as the Minister mentioned, in Victoria, we have had a legislated Health and Human Services Adaptation Action Plan for a number of years now. I think we're into year 3 of what will be a 5-year plan. And that has driven a lot of interest and work again in our department. So I think it's obviously really well recognised that climate change will have particular impacts. That's sort of just a picture or a snapshot of what we might be experiencing in Victoria. But if we can flick to the next one, there are, you know, some really recognisable indirect climate change impacts that have a direct impact on how we need to plan and think about as the health department and the sector. So we can move on to the next one. As I said, we have a number of actions under our Health and Human Services Adaptation Action Plan, and that's actually was developed when we were part of a broader department with Health Human Services as well. So we've still got a lot of areas of work together: urban heat, housing, as well as particular things where we're interested in really building up the resilience of the sector, the understanding and sector capability to be planning for adaptation actions. At the moment, we've got a couple of, we were successful in getting some grant funding to do specific projects. We've got one kicking off with workshops next week where we're really trying to help health services across the state plan for and think about how they need to manage climate risk. And we have a project specifically with the partnering with VATCHO and working with the Aboriginal controlled community health organisations to look at specific climate risk for around 6 organisations in the state. We've also had a lot of interest from our cemeteries sector, which are a big and important part of obviously land holdings, particular climate risks, but, you know, some real kind of innovation in that space. So a lot of the work that we're doing in these projects does have broader applicability to many organisations, and part of what we want to do is to be making sure we're developing products that can be shared and have, you know, broad sector relevance. So just moving on to our last pillar, collaboration is a hugely important part of what we do, and one of the things that we've been really conscious about reorienting with our new unit. So we spend a lot more time probably going out and talking to people than we had in our previous iterations. We're spending a lot of time talking to clinicians, hearing about their experiences. Great to, you know, be able to come and talk to the broader sector as well, which we're really excited and interested about. And we are also a participant in a particular transition to sustainable health systems consortium, which is really, again, in its first iteration, looking at getting to net zero for the hospital and acute health services sector, that again has a much kind of broader ambition over time. So we're really excited about being part of that. So we've got a monthly newsletter and we have a new sort of SharePoint site where we're trying to share resources. I'll put the email at the end, but you're very welcome to kind of express any interest in that, and those things are widely available. So just to my last point, if I can, the next one. Yeah, so upcoming opportunities that we thought might be of particular interest to the sector and some of your organisations. We, as I mentioned, have had our own success at receiving grant funding, particularly in the emergency management kind of funds. So we are quite keen to promote and support organisations for those opportunities as well. The Disaster Ready Fund is a national fund at the moment that we're looking at and thinking about how we can partner with any organisations to support particular projects that might help there. We're working on a number of things, including heatwave preparation, adaptation plans, backup generators, things like that are a number of the projects that we're aware of. The second one there is will be the result of the project that I mentioned at the moment, where we're going out to all health services across the state and really trying to develop guidance and tools that can be shared more broadly. And we'll continue to promote those sorts of opportunities and collaboration chances in our monthly newsletter. So I'll leave it there. And I think I've just kept 2 minutes to overtime. So hopefully we can have some questions and tea. Thank you very much.
Thank you so much, Heidi, and also keeping us well on time as well, which is really helpful. And thank you for your passion bringing to the Victorian government part of our climate landscape, your leadership to support those of us in the health sector in our organisational work. So now I'm going to invite all of those wonderful speakers to come up and share their wisdom on the panel, and the rest of you, if you need to have a stretch, if you want to grab a quick snack for the conversation, please do so while they come up and join us.
Me too.
Yeah, of course, absolutely. We appreciate your time.
Amazing. There's so much to say. It's fantastic. So much to say. I just worried about having to actually physically read
During the middle.
the not the right book.
Thanks for staying so long.
No, yeah, it's been really great. Work.
Thank you.
When you're answering any questions.
Okay, and I'll also remind those of you who are online, please post your questions for either the panel in general or any of our panel members specifically. Juanita's going to sneak away for other organisational commitments, but we have Julianne representing VCOS with us still. So please make your way back, those of you in the room, grab a quick snack and then make your way back to your seats. We're also going to enjoy morning tea after we have our 15 minutes or so of Q&A. So I keep refreshing my phone because I'm waiting for those questions from online. I will absolutely be bringing those questions as well. So please, as you heard from each of our panel members, we had quite a lot of wisdom in the room today from many different perspectives. So please draw on their knowledge and think up a question for us to further the conversation. Jen.
This is a question maybe more so for Kaha or VCOS. I work in advocacy at your community health. I've done a bit of advocacy work through partnership with both your organisations. I'd be keen to hear, what do you think is the most effective way to advocate to decision makers around goals of climate action?
Do I need to unmute? Okay. You want to?
Well, I think there is strength in numbers, and the breadth of those numbers are really important. So, you know, as I mentioned with CAHA, we've got 70 health professions, community health, tertiary health, private, public. I think what politicians and decisions need to make, we'll hear later, decision makers need to hear, is that you've got support. I think also case studies are so important, and just hearing and seeing about the progress here today, I can't wait to share this and amplify, you know, this story, because it's showing that it's already possible, and I think that goes a long way to then being able to convince decision makers and also influence other parts of the sector to act.
I agree 100%. Collective action between different organizations and sharing stories. I think also it was so great hearing from Lindsay about, you know, the experiences working on the ground, on the front line. Those experiences are really important to amplify to decision makers so they know what's happening to people. And I think that example of the hospitals are already at capacity, we can't actually deal with 43+ degree days, is really important information to be sharing. Also linking in with organizations like BCOS and CAHA to support our advocacy, learn from other organizations, and also, you know, tell us what your priorities are and what you want us to be advocating for is, you know, another important way.
Thank you both. Ben.
Thanks, Kat. Thanks, Rachel. I'm Ben from the Inner North Community Foundation. Thank you for your.
I'm going to get one of you to
speak into this.
Yeah,
thing.
just in case we can't hear you at home.
Hello, people online. I'm Ben from the Inner North Community Foundation. Can I just say how fantastic it is to have a panel just of women? It struck me when I was thinking about to frame the question that that's a really important thing for us to recognise and celebrate. So well done, your community health. 30 years ago, local people in Brunswick came together to do curbside recycling. They, as part of a Work for the Dole scheme, they knocked on houses and asked people to separate their rubbish. So I was really pleased to hear about the rubbish links to Recycling Week this week, and to be things that happened 30 years ago are then celebrated with national days. Can I ask the panel to reflect on what are the frames that are needed to mobilise action so that we have ideas that stick now that are mainstreamed 30 years in the future? So what are the, Michelle, you talked about needing economic frames for politicians. What are the frames that work to mobilise people? And you'll need this device. You've got a device.
We've got one. Does anyone else want to speak? Otherwise, I have some ideas. One of our speakers spoke about information. It might have been Michelle, trusted information. And a lot of people from the work that BCOS has been doing, people feel like, I've actually had somebody say, I feel like I'm being lied to, like there's information that seems to be changing. I don't know where to get trusted information. And I think community organizations, community health and beyond are one of the vehicles for providing that information and providing projects and services within climate resilience that people understand and trust. And I think education to communities is also, you know, a huge part of providing that information. Michelle definitely was talking about the education component of things as far as, you know, we don't want to provide scary messages to people, but we do want to, you know, be real about what the possibilities are and also provide information as far as what to do about it and available supports. And that's another thing that we've heard specifically, that people just feel like, I don't know where to go for support. Somebody said, I need support to get support. So I think providing that information and resources about, you know, what's possible and supports available is an important framing.
I don't know if this entirely answers your question, and it's much more on a micro level, and it's perhaps not about what's going to have its own day in 30 years, but I think if you want something to still be around in 30 years, from a, say, a clinical waste perspective, is having initiatives that can be embedded and aren't reliant on individuals. So I guess using as an example, the project that I'm running out is to reduce, we use a particular dressing pack, and most of it we throw in the bin, not single use, unused. We use a very small amount. So I've been trying to work with procurement to find a different product, and they have said no, because nothing is as financially beneficial. And their suggestion was, well, could you find a vet or a wildlife service that will take those extra things? And that is not sustainable. That might last as long as I'm in the department and I'm driving it to a vet. What we need to do is change the product that we use so that waste isn't created. And so I think that would be my advice, is don't have things that rely on someone to be doing an additional action, but change, you know, the I guess the fundamentals of the action, so that you don't need that extra step. And that's sort of what, once you've implemented something like that, then that will just continue and you're not reliant on individuals.
I'll just quickly say, join the dots. You know, as I did with the causes of climate change, I think we need to bring people along, and also, you know, make it accessible, make it tangible, and I think looking at the efficacy and efficiency of the way in which we, you know, deliver outcomes for patients and community.
And one of the things that we're doing at Your Community Health is really trying to shift the mindset around our decision making from not, is this something that we could do, or is this something that we want to do, but is there a good enough reason for us not to make this change? So particularly in regards to, you know, infection control and clinical changes, like, you know, it may be, you may have to spend a little more time using this product, or it may not, you know, be, you know, texturally as nice as what you want, or whatever the reason may be. But if this is a more sustainable option, like, is that a good enough reason to not make this change? And it's like, you look at sort of, you know, the changes in supermarkets around the plastic bags. Yes, they were convenient, and yes, if you forget to bring your reusable bags, the paper ones are a bit more expensive, so you have to pay for them now. But is any of that a good enough reason to not make those sort of changes?
Thank you. I've got a follow-up question from online that relates to the actions. Try and die from your perspective. Question for you. As the CFO, what is the cost of doing this work versus is there actually an economic gain for the organisation? What's the balance of those things in terms of resources?
Yeah, so it is interesting to have your CFO role leading this type of work. And so it is a question I get, like, when you move to electric vehicles, what was your business case? What was the return on investment? I think we're being a little bit fortunate in Your Community Health with such a strong commitment from the board that this is a change that we need to make, that you're not necessarily needing to justify every decision based on financial decisions. Like, for health organisations, there may not be a financial return on investment in terms of making these decisions. I think certainly in the commercial world there is, because I think it can be a real competitive advantage, and increasingly consumers are wanting to buy products that are coming from carbon neutral perspectives and stuff like that. But I can't say that there is necessarily a financial advantage for a healthcare organisation in becoming more environmentally sustainable, but it's just so mission aligned that you can't not do it.
But we do save on our power bills, at least.
There is a return on investment in solar power, and you don't have to do the business case. The provider will do it for you.
Thank you. Another question from the floor. At the back.
Hi, I'm Eddie. Thank you to each of the panel members today, just sharing from your incredible wealth of experience and insight as well. Just so much to learn, and just from different perspectives as well. So it's really been an enriching experience this morning for each and every one of us, so thank you. The question is, what are for health and well-being organisations who are often bound by, you know, really rigid funding models, what are some real key or effective, simple and practical ways that, you know, they can, you know, help with just, you know, building climate resilience within their local communities?
It's a great question. I think particularly in the adaptation space, we did a project where
Is yours red or green?
Now it's green. Sorry,
Oh.
it's red.
mine's green.
Yours green again.
Yeah.
Okay, thanks. Should be good.
So it was actually that in the event of you know, a particular extreme weather event, the hospital itself might be fine, but staff couldn't get there, services couldn't be delivered. You know, staff in remote areas weren't able to, you know, actually continue to deliver the services. So we've sort of been thinking a lot more, and I think actually rural and regional communities tend to do this very well anyway, is, you know, what does it actually look like to continue to be able to deliver the services that communities need in an event? And that's not really about the asset by and large, it's about the connections with other community organisations. So, you know, it's, or what is, you know, transport and logistics look like if I'm, you know, talking about that with my local council and with the, you know, school and with, so it's that connectedness I think is really, really key as a resilience factor, particularly in rural and regional, but I think more generally as well, that ability to kind of learn from like-minded organisations and think about resilience as part of a broader network. You know, you might not all be working in health, but you've all got kind of community interests at heart, I think is a good way to approach it.
I think that's a great point in terms of the ability to continue delivering services is something that community organizations, so VCOS thinks about not just community health, but all community organizations. That's what they want to continue to be able to do because their main goal is to support their communities and the people they work with. But often I find that community organizations don't necessarily think of the climate risk to their organizations. So they're not so much thinking about how are we going to continue delivering those services when there is an extreme heat wave, when there's a flood, bushfire, etc. They're thinking about how are we going to support our clients, but a lot of supporting their clients is thinking about themselves first, I guess kind of putting the oxygen mask on yourself before you can help other people. And so I think it is really important to think about preparing in advance to the extent that you can, thinking about those different scenarios of what could happen and how are you going to respond so you can continue, you know, when the hospital is already at capacity, how are you going to somehow get extra people in and help them? Another thing beyond that, I think, is just, for me, there's kind of two streams within climate action or climate resilience. There's the reducing emissions mitigation side, and that's often the costlier side. It's not always that return on investment. But then there's also the kind of adaptation and supporting communities to deal with those impacts long term. And that's often the side that can be cheaper or free. And you can do a lot in terms of, like we spoke about, advocacy to different levels of government, but you can also implement small programs, projects to help community members in different ways that they might need, like education campaigns. VCOS has lots of great members doing lots of different things like building community gardens to build resilience within, you know, just small community groups, but those are things that can be replicated across the state, educating communities about heat, especially with different communities that might not speak English, and having kind of like bicultural workers spread those messages amongst their networks. So lots of different ideas. If you come along to our climate network meetings, those are the kinds of things we're sharing.
Amazing. I'll just add brilliant answers. But just thinking about a scenario, again, working in a regional health service, thinking about how important those relationships were, thinking about some of the learnings from COVID, where we weren't necessarily as prepared as we would like, but having to pivot really quickly. And, I had to set up 10 testing tents, across the region. And so having those relationships with the community organisations to be able to do that, thinking about that scenario planning is really not just thinking about it, doing the scenario planning, but to state the obvious, really understanding the stakeholders, the partners that are available, and thinking about the models of care as well, which again, during COVID, we pivoted to deliver more care at home, which is actually, we know, better for community outcomes. And we had to do it. And now we've got that sort of precedent, and we've sort of shown that we can adapt quickly.
Funding for that relational infrastructure? If relationships are critical, who's funding that?
Yeah, it's a really good point. Community foundations are pretty critical to get people together, because what we need is actually people that can step out of the everyday, clinical roles to be able to do some of this relationship and systems work. And, I wouldn't say, and again, I've got a perspective across Australia, that is well resourced. I'll let my colleagues comment on that in Victoria, but I think there's more work to be done, and it's critical.
That same comment from Jackie online around resourcing is still a barrier, and that funding roles to lead this change work is really critical. So take that as a comment. Looking at Heidi as our government representative, but also, of course, the responsibility for that is broader than that. And I like those responses and that conversation that is really about needing also to take a place-based approach to this work and leveraging all the stakeholders, as you, Julianne and Michelle said. And I know not only the climate change stakeholders that we're drawing on today, but the work that we do within our local community. We have amazing, passionate neighbourhood houses and community foundations and our local council to support us. So there is a network that we could build and draw on in this work. I'm going to have, it might be our final question, but it also relates to this need for resourcing of this work. And the question from Vanessa around, where would you recommend for organisations to go to investigate grant opportunities to support organisations in this work? I know a couple of you mentioned resourcing. Heidi, you were talking about potential grant opportunities. Maybe start with you, and if others have any guidance.
Yeah, so I mentioned a couple. It obviously often depends on the type of organisation and what you're looking for. I think as a general point, we're really happy to, receive kind of inquiries and help redirect. Other good sites, I'd always recommend, if you're not already familiar, the site of our Environment, Energy and Climate Change Department here in Victoria, DECA, has a lot of good resources both in adaptation and then links to organisations which I think you're already familiar with, like Sustainability Victoria. And then we have in health in particular, we have had sort of infrastructure funding at various times through our what are often dubbed RIF and MIF programs, which can be supportive as well, depending on the eligibility of the organisation. But I think, there's a few kind of starting points, and always happy to take questions.
Any comment on that from philanthropists in the room, Ben?
There's no magic secret bullet to this stuff, right? Like I think part of the challenge is that local relationships and the capacity to connect with your peers who care about a particular place can be constrained by some of the competitive funding streams, right? So if you're in a competitive funding arrangement and then you have to go and collaborate, that gets tricky, right? And so, I think place-based approaches are back in vogue, and that's a good thing. And there's some stuff coming out of the federal government around that. So, happy to chat more too.
I think a lot of the potential streams have already been really touched on. The Victorian government has a lot of great grant opportunities and different funding opportunities, especially around reducing emissions. One of the things I'll add is Lord Mayor's Charitable Foundation is one of those philanthropies that a lot of community organisations turn to. They've got a specific funding stream around healthy and climate resilient communities. They've also got one around housing and homelessness and one around workforce. So those are that's another potential funding stream So philanthropy.
Thank you. I might take this opportunity for us to wrap up and soon move on to sandwiches here for those in the room and for you online to get a break as well. So please join me in a big, grateful, heartfelt applause to Lindsay, Michelle, Julianne, Di and Heidi. I don't know about you, but I'm feeling really inspired. Often when we think about climate and we've heard we know the enormities of the issues and the challenges, but I feel so inspired by hearing people and understanding the level of work that's going on in organisations and sectors to tackle this issue, and also the level of passion and wisdom and creativity that's being brought to bear, and then also the lovely examples of work on the ground and actions that are being taken in health services, such as our own, such as where Lindsay works, and I know in each of your organisations as well, that really does give us a sense of hope that together, through practical steps, through developing action plans, through embedding changes in processes that are going to stick and stay within organisations, we can start to make an impact. So I want to acknowledge everyone's contribution for the day. We've got a wonderful, amazing team here at Your Community Health that have helped bring this event together, from our coffee cart buddies at the back to my amazing team here that's brought it all together. So thank you to each of you for your commitment and passion in this space. It's a beautiful thing to work with each of you, and of course, as we've seen today, working in this space is so many passionate and wonderful people that just makes the work really enjoyable. So I know I don't need to recommend to any of you to go off and create great things for change in your organisations. Thank you so much for joining us today. Reach out to us at any time for future info, and my colleagues and partners. Thank you, everyone. Please grab a friend first.